Chapter 1. Recognizing the Signs. Ever wondered why some days feel heavier than others? Or why a loved one seems to have lost their spark? It could be more than just a bad day or a temporary mood swing. It could be depression. Depression, a common but serious mood disorder, affects how you feel, think, and handle daily activities. It's more than just feeling down or having a rough day. It's a persistent feeling of sadness and loss of interest that lasts at least 2 weeks. Now you might ask, what are the signs to look out for? Well, the symptoms vary from person to person, but here are some commonly observed ones. Chapter 2. Symptoms of depression. Firstly, a persistent feeling of sadness, anxiety, or emptiness. This isn't the occasional blues that everyone experiences. It's a constant, unshakable feeling that lingers. Secondly, a loss of interest or pleasure in activities once enjoyed. This could include hobbies, sports, or even social activities. Thirdly, changes in appetite or weight. This could be significant weight loss or gain, or fluctuations in eating habits. Fourthly, sleep disturbances such as insomnia or sleeping too much. Next, physical symptoms like restlessness or slow movements, often accompanied by feelings of worthlessness or guilt, difficulty thinking or concentrating, and recurrent thoughts of death or suicide. Lastly, unexplained physical problems, such as back pain or headaches. Remember, these symptoms must be severe enough to cause noticeable problems in relationships with others or in day-to-day activities. And if these symptoms persist for at least 2 weeks, it could indicate depression. Chapter 3. Understanding depression. To recap, depression is a serious mood disorder that affects your daily life. Its symptoms include persistent sadness, loss of interest, changes in appetite or weight, sleep disturbances, feelings of worthlessness, difficulty concentrating, recurrent thoughts of death, and unexplained physical problems. Understanding these symptoms is the first step towards seeking help and starting a dialogue about mental health. So, if you or a loved one exhibits these symptoms, don't hesitate to reach out to a healthcare professional. Chapter 4. Seeking help. Remember, it's not just about feeling sad. It's about a persistent feeling that affects your whole life. And it's okay to seek help, because in the end, mental health matters just as much as physical health.